Well, Dr. Duhon, thank you so much for
Sure.
taking time to speak with us. You know, we are just so grateful for the impact that you're making on the patients that we serve at Believe Big.
Sure.
You know, you play such a vital role in their cancer journey, and so we're so grateful for
Thank
your
you.
influence.
Yeah, thanks.
Yes, and I know that you have extensive training in naturopathic medicine, acupuncture, Oriental medicine. You studied in Switzerland.
Yes.
And gained additional specialty training in oncology. And then most recently, you took the Mastermind Intensive course with
Yes.
Dr. Winters on the Terrain 10 approach.
Yes.
So how has this terrain-based treatment approach changed the way that you determine a plan for your patients?
That's a good, I think it's, it kind of moves you away from protocol-based into more of, when you're looking at the person, you're looking at the whole terrain. You're not just looking at one thing where this one protocol is going to do that, but you're looking at the whole person. And
Yes.
sometimes there's patterns in the terrain that you can address, and like strings you want to pull first, and that's kind of how the Terrain 10 approach has helped me. I've been kind of sharing patients with Dr. Winters for, well, since I've almost known her, really.
Mm-hmm.
And I've kind of picked up nuggets from her along the way. And when she asked me to be part of the Mastermind program, I was like, yes, more please.
Mm-hmm.
So it really kind of brought together what I learned in, basically at Paracelsus, because they all have pieces. People have pieces, but the Terrain is more of a comprehensive approach.
Yes.
To looking at someone in an integrative way of testing, assessing, addressing,
Mm-hmm.
not guessing. And that's what I get. A lot of people want me, oh, just give me this. And I was like, I don't guess. I need to see this.
Yes.
And so,
Evidence.
yes,
Mm-hmm.
exactly.
Mm-hmm.
I want to see if this treatment working and how it's working, and this is what we, because it's pointless just to put people on protocols and then not really address or check in if that protocol or if that therapy is really helping them.
Yes. Effective.
Yeah. So that's really kind of what the Mastermind program has helped me solidify a little more in my own process with my patients.
That's fantastic. Yeah. And so in closing, I would love to know if you have a patient success story that you're able to share with us.
The patient that does come to mind, she's a 53 or 54-year-old female, and she was diagnosed with breast cancer. And now she's stage 4 breast cancer because she had metastases. I'll use past metastases in the lungs and the adrenal gland. And then when she came to me, they had went up to the brain. And she had surgery, and then after her surgery, she was searching for an integrative doctor to help her and to work as part of her team. And then she was interviewing doctors, right? She was wanting to see who was going to be the better fit, and so she chose me, which I was like very honored, because she's a lovely patient. But when I started with her, part of she had 12 nodules in her lung. She had something on her adrenal gland. The brain was kind of stable, and we were monitoring that, but there was just activity. And so we started testing. We started addressing certain things. And after about 12 weeks, she was getting scanned every 12 weeks. And so that was perfect, because it would show us like what the therapy really do.
Yes.
And after the first scan, nothing in the lungs,
wow.
Nothing in the adrenals,
wow.
Brain was stable, and she was stable. And
wow.
she's been that way since.
Well, I love that story, because so many times when people hear cancer, it's almost like it seems many times as a death sentence, especially
yes.
hearing the type of cancer she had and how it was so invasive in her body. But what I love that what you're doing is, after testing, addressing, and assessing all that she went through, that people can have great quality of life, and they can
mm-hmm.
manage their cancer really well without being weakened and depleted
yes.
and at home.
Yes.
So what you as a physician are doing through this terrain-based treatment approach, and through your different therapies that you offer to your patients, is that for those who it may be a terminal situation, they can continue to walk through life with great quality of life.
Yes.
and not just quantity.
Yes.
So that's one of the things that I appreciate most about this side of medicine is that you help a person get their life back and to get to the root cause of disease. So thank you again for taking this time, and we're just really thrilled with all that you do for our patients. So
sure. Thanks for inviting me. I appreciate it.